Hello friends, in this video lecture we will discuss about the remaining 6 categories of contraceptions. As in previous video lecture we discussed about only first 2 categories of contraceptions or birth control, that was natural method and barrier method, and here out of that remaining 6 the first one is chemical method of contraceptions. So there is a number of chemicals available in market that have spermicidal property, and they all are available in the form of creams, jelly, foam, tablets. Telfen is one of the example. Spermicidal means that causes death or killing of sperm. These creams or chemicals injected in vagina before copulation or sexual intercourse. So when sperm reaches into the uterus or vagina, there will be death or killing of that sperm. Fourth one is intrauterine contraceptive devices, IUCDs, or intrauterine devices, IUDs. These are the devices that are injected by the doctors or expert nurses in the uterus through vagina. These intrauterine devices are available in 3 formats. First, non-medicated or inert IUDs, example is lips loop. Second is copper releasing IUDs, example is copper T, copper 7, multi-load 375. Here they all are named because of copper area that they are carrying in square millimeter. And the third one is hormone releasing IUDs, progestasert and LNG20. These are the examples. So all these examples of IUDs are very important. Now what is performed by these IUDs? So all these IUDs causes phagocytosis of sperm within the uterus. Phagocytosis, this is you can simply understood like killing or death of sperm by these IUDs. Second, copper releasing IUDs especially, they suppress sperm motility by their copper ions, and that's why fertilizing capacity also getting highly reduced. Next, hormone releasing IUDs, they additionally makes uterus unsuitable for implantation and cervix becomes hostile for sperm, means there is no additional support for sperm that is provided by uterine muscles to reach them up to egg or ovum. When we discuss about contraceptive methods or birth control methods, IUDs are the most widely accepted method of contraception in India. Next is oral contraceptives or oral pills. This is only and only for female, and here a small dose of progestogens or a combination of progestogens estrogen given to a particular female. This method is highly effective with lower side effects. These oral contraceptives available in market in tablet form, and these are popularly known as pills. So these pills taken by a particular female if she don't want pregnancies for 21 days in menstrual cycle. As we discussed, menstrual cycle is for 28 to 29 days. During that, from 5th day onward up to 25th day of menstrual cycle, the particular female have to take these pills, and again this will be repeated after a gap of 7 years during menstruation. These pills causes inhibition of ovulation, implantation, and they also alter the quality of cervical mucus that prevents or retard entry of sperm inside the uterus. Mala D and Mala N, these are two examples of oral contraceptive pills. Saheli is a very new oral non-steroidal contraceptive pills. This commonly also known as once a week pill. This pill is developed by CDRI, Central Drug Research Institute of India, that is located in Lucknow, Uttar Pradesh. This pill is of high contraceptive value with lower side effect, and its chemical composition also known as centchroman. The sixth one is injectables and implants. So injectables and implants, again they have same effect like oral contraceptives or oral pills. Why? Because they also have the same composition like a dose of progestogens or progestogens estrogen combination given here also. But oral contraceptives, this one is taken orally, while here these are injectables or implants, means they have to be inserted or planted just below the skin. Now if we discuss about the mode of action of these injectables or implants, so as we earlier discussed, they have same effect like oral contraceptive pills, while the effectivity or effective period of injectables is comparatively many times more than oral contraceptive pills. What is the difference? So one difference we discuss, they have to be taken orally while this is injected below skin. So this one is available in variety of forms, like maybe available for 1 year contraception, 2 year contraceptions, and also for many more year contraceptions. So here there is no need to take on daily basis, but in this case a particular female have to involve regularly for taking that particular pill. Now the next one is emergency contraceptives. So as the name suggests, they are used only during emergency period. So these contraceptives used for treating emergency contraceptions, and that's why they also called as morning after pills. This is a misnomer but used. This prevents pregnancy if taken within 72 hours after unprotected sex. This could be used to avoid possible pregnancies due to rape or casual unprotected intercourse. There are few tablets available in market like I pill and unwanted 72. So this emergency contraceptives is very useful but also have a huge side effect. If there is frequent use of this tablet or this kind of contraceptive pills, the uterus will become incompatible for further pregnancies, or there may be a risk of no pregnancy in future for that particular female who is using frequently this emergency contraceptives. The last one is surgical method or terminal method. This also known as sterilization. This is available for both male and female. Here there is prevention of semen transport in male while ovum or egg transportation in female. So sperm and egg, they never comes in contact. That's why no fertilization, no implantation, and no pregnancies. This is a permanent method. Here reversal is very tough. That's why this also known as terminal method. In case of male, this sterilization is known as vasectomy. Here in this case, a small incision is made on each side of the scrotum and vas deferens is cut and its end tied up. That causes no conduction of sperm from testis to urethra because of blockage. But In this case, spermatogenesis will continue. Semen will pass out, but that semen is carrying only seminal plasma. There is no sperm in that because vas difference is already cutted and blocked. So there will be secretions of only seminal vesicle, Cowper's gland and prostate gland. Now about female sterilization, that is known as tubectomy. So here in this procedure, tube, that is fallopian tube, also known as uterine tube or oviduct, the same like in case of vasectomy, are just cutted and their ends tied up. That's why there will be no conduction of secondary oocyte or egg, or we can say sperm. That's why there is no chances of fertilization and pregnancies. After all, when we discuss about all these methods of contraceptions or birth control, broadly we can categorize all these 8 methodology into two: natural method and artificial method. So remaining 7, they all are artificial method. Except natural method, all other methods of contraceptions are, as we discuss, unnatural. That's why there may be some side effects.